Hi there, it's me, Brodie McLeod, here again with another one of my quite boring Wastecast videos. Today, I want to talk a bit about NHS structure and mental health treatment. I've been in hospital for about a year. I spent about 10 months in hospital with Signet Healthcare in 2023 too. And I've been sectioned about 8 times. Well, every year since 2018, I've spent a bit of time with Signet and also at NHS hospitals. Broadly, with reference to the scope of this video, I wouldn't say that NHS hospitals are significantly better than private subcontractors. The food is much better at private subcontractors, and the general level of facilities is better, but they operate under their own set of rules and they cost a fucking fortune. And yesterday, I was presented, a few months ago, I put in a complaint because a staff member had defaced their ID. So the second name was removed from their ID badge. I said, what's the point in wearing an ID badge if you can't be identified? It turned out that there was two people with the same name working on the ward. So if I wanted to make a report to the CQC or the police, who are the only people that are going to regulate private healthcare fund, organisations, well, that's not strictly right. You can go to the NHS. I could complain to the NHS Trust funding my treatment, as could anybody. But that's a bit of a digression. I mean, what I'm saying is that they act under their own set of rules, and all mental health patients, if you go to hospital with any other illness, you'll be treated in-house by the NHS, and they can adaptively and competently regulate and integrate new policies, procedures, quality control, and just general management structure into those businesses on a kind of on the fly basis, where they have the ability to make sure that hospitals are run properly, and they can adapt very quickly if they need to. They don't have to, wait for a third party to govern them or give them, advice or guidance or deem them to have acted improperly. And I saw a nurse yesterday. I was in the office downstairs in the lodge, and there was not a nurse, I don't think, just a member of staff. And I noticed that her ID badge was defaced, so you couldn't see a second name, and her face was like all sort of rubbed off. It was it was just a really old ID badge. A nurse did say, come up with a very valid argument to me about privacy of ID badges. She said that if people were on the open register with the electoral roll, then they could be identified by patients, and they might have animosity or motives towards them, and so they've got a right to privacy. That's not what the kind of broad interpretation of CQC and NHS guidance found. Here's an example of an email that I got when I tried to, from an IMHA, when I tried to raise the point of somebody having, a defaced ID badge. So I saw this nurse who was giving me medicine. I saw that she defaced her ID, and I said, this can't be right. You're trying to act anonymously, and you're creating a barrier between transparency and your duty of candor. I don't know who you are. If it had been the other way around, and I'd been a woman and she'd been a man, and she'd opted to wear a balaclava to work and was stood at my door with a syringe, then people might look at this in a slightly different, vulnerable context. I'm not assuming gender identity roles or kind of stereotyping masculine versus feminine, but it made me feel vulnerable, and it made me feel that something wasn't done right. When I wrote to an IMHA about it, they said, following our conversation yesterday, I've looked at the CQC regulations referred to. Regulation 20, duty of candour. I've only encountered this as part of the response to serious incidents. For example, injury in hospital care. Incident they define as notable safety incident where a duty of candour report is intended as part of the learning process to be transparent in what took place and ensure shortcomings are learnt from, as opposed to a mindset of avoiding blame and denial. Whilst this regulation It's focused on being open and transparent. It doesn't appear to be designed to cover obscured ID badges or withholding of PRN. So I'd asked for some medication and I was refused when I was suffering severe anxiety at about 4 a.m. She didn't feel that I was presenting with, that was the dispute, and that was why I asked for her ID so I could make a formal complaint. It goes on to say this email does mention psychological and physical harm, but only in sustained terms defined as for a continuous period of at least 28 days. Regulation 19, so I'd got these regulations after speaking to the CQC on the phone, and they told me that all these regulations were relevant to their regulatory framework and would be relevant if I wanted to go to the Nursing and Midwifery Council, put in a complaint to the NHS Trust funding my care, or put in a complaint to the hospital. So Regulation 19, in this guy's interpretation, fit and proper persons employed. CQC states they will refuse registration of any organisation that cannot satisfy them of compliance with this regulation. This section seems to be focused on the employers and CQC's responsibility to ensure staff are qualified. The only account it takes of the patient or client is in stating providers should respond without delay to concerns about a person's fitness or ability to carry out their duties. This includes responding immediately if there's an imminent risk to people working in and using the service. The response taken to concerns about a person's fitness should be fair to the person and follow correct procedures. So whilst it covers an expectation on Signet to comply with CQC regulation and satisfying CQC of appropriate checks and processes, it doesn't offer rights to the client or service user to conduct their own checks of an employee's suitability. So he's saying I've got no right to check the NMC website effectively, that ID badges that are defaced. I can't go onto the Nursing and Midwifery Council, check that a nurse is bona fide and qualified. I'm not suggesting they're just going to let criminals walk into the hospital and act with impunity, but it does create a barrier to transparency. Regulation 9, person-centred care. This deals with making responsible adjustments, ensuring the individual involved in the care and treatment where the individual lacks capacity, decisions are made in the best interest, evidencing best interest process is followed. Closest I've experienced this relating to the ID badge point was to argue for ward staff where larger, clearer name badges bearing first names to minimise the client's distress of being overwhelmed with the number of names to face just on the wards. They wear like yellow badges as well as photo ID cards on lanyards. It says I'm unaware of any regulations already come across. I won't read you the whole thing. You can read it if you want to pause it and stuff, but basically said wasn't a problem. I did my own research on Gemini, and I did a deep research of 147 websites. You can see in the video, I'm wearing like a branded fleece and a lanyard, which I got off Amazon for, a few quid, and it didn't make me, and it says service user on mine, but it doesn't qualify anything. I was just doing it to make a point, so anybody could get a lanyard or a fleece. If you can't identify them, then it doesn't mean anything. This was the Gemini document. It's not useful. Wait a second, I'll show you the Drive document instead. If you want to read this, this basically flies completely in the face of what the IMHA said. It was like the IMHA was just airing to almost defend the hospital, and we had this dispute where eventually I got all this very, very, very well researched qualitative data, scroll back through my videos and find a link to it, or I'll copy a link and post it in this video description. But it says in the job descriptions, it says you've got to wear a photo ID, and NHS policy, NHS fund Signet, it says you've got to wear a photo ID in clinical areas at all times. You don't have a right to anonymity if you're practicing medicine in a clinical area in a psychiatric ward. And the CQC regulations overarchingly support it too. So, there was a massive disconnect between what this dude said, independent advocate, he came to see me about it, and we sat down and we spoke about it. We've got a voice note of it somewhere, and, he was really polite and professional, but when I got his email, I was like, nah, this can't be right. This can't be policy, and I don't know, I just sort of didn't really think that there was anything I could do about it. The CQC and the Nursing and Midwifery Council, I got the email back from, I can't remember which one it was, and it literally had a line on there that said, like, it might be some time before you hear from us. And, I'm not going to, there is no other kind of, the Nursing and Midwifery Council and the CQC are the only organisations that can intervene. Aside from NHS, I suppose you might argue on balance, to play devil's advocate, that I could put in a complaint with my key worker or my care coordinator, and they would follow the same administrative profile and procedural narrative as the NHS would do in an NHS hospital. But then you haven't got the £500 million that they make in profit, Signet Healthcare this is, every year, which is just money being taken directly out of NHS budgets. £500 million isn't very much in NHS budget. NHS is the biggest employer in Europe. On a bad year, they cost, upwards to 500 billion. On a good year, it's like 250. I mean, check out the figures for yourself. It's a small margin of the total NHS budget. But why is it that we sort of have a privately funded, privately regulated mental health system where things can go awry without anybody necessarily being able to do anything about it in the most immediate sense? So I asked Gemini, what are the common criticisms of the UK mental health system being primarily composed of private subcontractors such as Signet, the Priory and Elysium? I've actually been treated by all of these guys at points in my life. Predominantly, I've spent a lot of time with Signet. With these organisations treating an average of 50,000 patients sectioned under the Mental Health Act each year, and with Signet revenue for the year ended 31st of December 2023 at 601.5 million against 555 million in 2022, along with private companies having more free rein to effectively act with impunity when it comes to service delivery, making their own policies sometimes in stark contrast to NHS equivalents and answerable predominantly only to the CQC, who only intervene retrospectively following an incident or service delivering substandard care. Is the UK government wasting money and placing mental health patients at greater detriment by outsourcing and relying on private healthcare services rather than treating patients in environments they can qualitatively regulate and ensure are safe and fit for purpose, as well as operating in a financially efficient way, as opposed to private corporations? Private corporate companies have a vested interest to increase their own profit margin and remain financially stable. If all cancer patients were referred to private hospitals, there would be, I'm sure, a public outrage at the financial loss to the public purse and the potential degradation and inconsistency of treatment. So why is it deemed acceptable to do this for the demographic of those suffering with mental illness? Gemini said the outsourcing of mental health services in the UK to private companies like Signet, the Priory and Elysium is a highly contentious issue. Sorry, I had to pause while they did the obs on my door then. So yeah, outsourcing to private companies is a highly contentious issue, and my question, highlights many of the key criticisms and concerns. The arguments against this model are multifaceted, touching on issues of quality care, financial efficiency, accountability, and the fundamental principles of a publicly funded health service. Common criticisms of private subcontractors in UK mental health. Quality and safety of care. Number one, safety failings. A significant and recurring criticism is that private mental health hospitals have been repeatedly criticised for unsafe care, with coroner's inquests and CQC inspections identifying serious failings. These have included issues with patient observation, risk assessments and communication among staff and with families, which have been linked to patient deaths. Use of restraint and seclusion. Reports have found that some private providers are more likely to use physical restraint and seclusion, which are like padded cells, on patients compared to NHS mental health providers. This raises concerns about the therapeutic environment and patient safety. Staffing issues. A lack of adequately trained and experienced staff. They use a lot of agency staff here, particularly for complex cases or specific patient demographics like young people. It's been a persistent problem. This can be exacerbated by the use of temporary staff and a lack of proper induction and training. Inappropriate placements. Patients are often placed in private facilities far from their homes, disrupting their social networks and family support, which is a known barrier to recovery. See my other videos for more on this. This practice is often more expensive than using local NHS services. Financial efficiency and profit motive. Cost to the public purse. The NHS spends billions of pounds annually on private mental health hospitals. An analysis by The Independent found that NHS spent over $2 billion on private psychiatric units in a single year. The cost per patient per day in a private bed can be significantly higher than in an NHS bed. Profit versus patient care. The fundamental criticism, as you've pointed out, is the inherent conflict between a company's need to generate profit for shareholders and the public interest in providing high quality, safe and efficient care. The rising revenues companies like Siglet fuel this concern, as critics argue that money that could be invested in the NHS is instead being siphoned off as profit. The lack of investment in NHS. The reliance on private providers is seen by many as a symptom of decades of underfunding and a decline in the number of available NHS mental health beds. This forces the NHS to turn to the private sector to fill the gap, creating a cycle of dependency and high costs. Accountability and regulation. CQC's role. While the CQC is the regulatory body, common criticism is that its interventions are often retrospective, occurring after an incident or a period of substandard care has been identified. This can be seen as too little too late approach where patient harm has already occurred. Lack of public scrutiny. As private companies, these providers are not subject to the same level of public scrutiny and transparency as NHS trusts. Their policies, operational procedures and financial details are not as readily available, making it difficult for the public and policymakers to hold them fully accountable. And they do have divergent policies. The ability of private companies to create their own policies, which might differ from NHS equivalents, can lead to inconsistencies in care and treatment standards. NHS allow you to take voice notes with your mobile phone, for instance. I've had a long-standing dispute and still an open complaint, which has been escalated to secondary review about recording my ward rounds and recording my consultations. They just won't let me. NHS says it's the note taking forms part of your medical records. They're confidential to the patient, not the consultant psychiatrist. But yeah, Signet just don't allow it. The comparison to cancer care. Your analogy to cancer care is a powerful way to frame the issue. The public outrage would likely be immense if a similar level of outsourcing and profit-driven care were applied to physical illness like cancer. The question of why is it deemed acceptable for mental illness touches on a deeper societal issue, the historical stigma and undervaluing of mental health. For a long time, mental health has not been given parity with physical health in terms of funding, resources and public perception. The current system, with its heavy reliance on private providers, is seen by many as a continuation of this disparity, where some of the most vulnerable people in society are placed in a system that may not prioritise their well-being over financial interests. So yeah, I don't think that it should be private. I think that mental health services should be nationalised, regulated, properly delivered, and I don't think that people who are, it's costing that profit margin is a metric for loss, basically. Like that profit margin, every penny that the Priory, Elysium and Signet Healthcare make is all money that the NHS have lost, effectively, and when we've got people arguing about immigration and strain on the NHS, I don't know what the roadmap would look like. And NHS building. Signet have got about 2,600 beds in the UK. I know because I had to research it for a document I was writing, and about 150 hospitals, and they make a fucking fortune. So I don't know how many hospitals they'd have to build, and with, vulnerable adults, elderly people with neurodivergent and acquired injuries and disabilities also being included within the scope of the provision of these private organisations, subcontracting their care with NHS funding them. It's a very, very, very broad scope of interpretation. I mean, the level of care is good, like the environments are good. Like if you look at these rooms, they are kind of finished to a high standard. Bathrooms are a bit grotty sometimes, but they're not like shitholes. And the resources of the staff, like the occupational therapy and psychology, and generally the staffing, the human resources are quite good. I've been in NHS hospitals where the food's been very poor, the staff have been a bit ambivalent, and things haven't been done properly, just like I would say about other private providers too. But I think if it was down to me, I think that we should nationalise our mental health system for the good of the patients, for the good of the NHS, and to conserve the vital resources that we need to help the NHS carry on saving lives. It saved my life in 2024, and I'm very grateful for that. They have had problems since then, which may have, accumulated or concerned NHS policy and procedure not being adhered to, and staff maybe not doing things quite as well or properly as they should do. But that's my wastecast for this morning. I'm going to have some breakfast and a cup of coffee, and wait for the morning meeting at 10 a.m. where they show us the activities which are going to be on for today. We plan our day and we go from there. But thanks for watching. Don't forget to like, comment and subscribe. And if you've ever been sectioned under the Mental Health Act or know somebody who has, then let me know. Did they go to an NHS hospital and get good treatment or poor treatment? And if you know anybody that's been to both, do you think that an NHS hospital is any better than a private hospital? Let me know, unless you're that one dude that just comments with stuff like my brother should be in heaven, sort of like a veiled threat and a bit insulting, but is obviously hoping for a reply from me. Other than this one dude that always trolls my videos, if anyone else wants to comment or share this, then you're highly welcome. Have a good day, and may your mental health be good.